Hi everyone, my name is Elizabeth Akincilar and I'm the co-founder of the Pelvic Health and Rehabilitation Center. I currently treat in our East Coast offices in Bedford, New Hampshire and Lexington, Massachusetts. And because May is Pelvic Pain Awareness Month, we are doing our 5-part webinar series, and this week we are going to be discussing male pelvic pain as the 4th part of our webinar series. So So first we're going to talk about some terminology. So male pelvic pain is referred to in several different ways amongst medical providers. You may hear it described as chronic pelvic pain syndrome, or often abbreviated as CPPS, or chronic non-bacterial prostatitis, and we'll get to what exactly that means in just a moment, and male pelvic pain syndrome. So all of these terms are used fairly interchangeably and all mean basically the same thing. So the National Institutes of Health categorize prostatitis into 4 categories. That first category, category 1, is an acute systemic infection of the prostate or bladder. That means that there is an actual culture-proven infection to the prostate or bladder that should be treated with antibiotics. Category 2 is when that same bacterial infection becomes chronic or long-lasting, also needed to be treated with antibiotics. Category 3, on the other hand, is what we're really interested in for today's talk. Category 3 is actually chronic pelvic pain syndrome, or male pelvic pain. That means there are similar symptoms to prostatitis without the evidence of infection. Right? So upon looking for a bacterial infection in the prostate or bladder, there is no infection found. So that would be category 3, also known as chronic pelvic pain syndrome. And then category 3 is broken up into 2 subcategories. Category 3A is with the presence of inflammatory cells in the prostatic secretions. Category 3B is without the presence of inflammatory cells in prostatic secretions. And then lastly, category 4 is asymptomatic inflammatory prostatitis. So when we look at statistics on how frequently does this actually occur, it's actually quite surprising. So worldwide, studies have shown the prevalence of chronic pelvic pain syndrome is between 2 and 16%, but it's the most common urological condition in men under 50 years old. So if you think about that, the most common urologic condition for men under 50 years old, that's pretty significant. It's also 90% of prostatitis cases in outpatient clinics. So when we were talking about just a moment ago about those different categories of prostatitis, 90% of them are actually chronic pelvic pain syndrome and not a bacterial infection. And then this is the statistic that is really staggering. The symptoms are often present for an average of 87 months or over 7 years before men get a proper diagnosis. So the symptoms really vary. The symptoms can be some of what I'm going to talk about, or all of them. It really depends on the person. Urinary symptoms are typically part of this, and that could be urinary urgency, which is when you get a strong urge to urinate. Urinary frequency, which is when you urinate more frequently. Normal frequency is approximately every 3 to 4 hours. Urinary hesitancy is when you have a delayed start to your urine stream, that you want to urinate, but there is a delay. And then dysuria means pain with urination. As far as pain goes, pain can really vary in the pelvis. It could be lower abdominal, could be perineal pain, it could be genital pain, anal pain. It really depends. Pain during and or after ejaculation, particularly after ejaculation, is a very common symptom that we see in our male patients. We'll talk a little bit more about that later. Erectile dysfunction, we can see that could be difficulty getting an erection, maintaining an erection, or pain after ejaculation. And then lastly, difficulty with bowel movements. And we usually see this as difficulty evacuating stool or symptoms like constipation. So, of course, many people ask, why am I experiencing these symptoms? We see many, many people who are very healthy otherwise, and that are suffering with pelvic pain. So there are more causes than I'm going to talk about, but I would say the four main categories of causes of pelvic pain are these. So the first is trauma. And this could be a surgical trauma, say from some sort of procedure to the prostate, or maybe a hernia repair, or it could be an injury or fall on the buttocks, say from a skiing accident or a slip and fall on the ice. Could be due, and the reason for that is when there is a trauma to the pelvis, the muscles, tissues, and nerves respond, and sometimes that response develops into pain. Exercise is another very common cause that we see in our male patients, and often it's something like cycling or horseback riding or weightlifting. And the cycling or horseback riding is because you spend a lot of time on a small seat, so there's a lot of pressure on those pelvic floor structures, both muscles and nerves. Weightlifting is a little bit different. So we're talking particularly about squatting with heavy weights. So when we squat, the pudendal nerve, which is a nerve that innervates part of the pelvis, the pudendal nerve is flossed over a small bone in the pelvis. And when it is flossed under tension, like with squatting with weights, it can put more strain on that pudendal nerve, causing the nerve to become irritated or painful. So for those who consistently do heavy squats, it can result in some people in pain. The next is chronic constipation. And this is because when we're chronically constipated, we have to strain in order to evacuate stool. And when we strain, we also put strain on the pudendal nerve. So that nerve over weeks, months, years of being strained during a bowel movement can also become painful or symptomatic. And the last one is excessive sitting. And I know this is a very general kind of term, but we see people that say that they developed pain after maybe beginning a new job that involved a longer commute and then sitting all day at work, or something that changed their habits. And long periods of sitting can compress the pelvic floor muscles and nervous structures, which can result in pain. So if you're having these symptoms, how do you diagnose it? So first and foremost, you really need to consult with your urologist or your PCP to rule out infection or any other pathology in your pelvis, whether that's in your genitourinary tract. If you have something that should be treated by a medication or some sort of surgical procedure, that needs to be figured out and treated appropriately. If you have gone through all those clinicians and had that testing done and everything comes back negative, then you should really visit a pelvic floor physical therapist. So treatment is very often, if not always, multimodal. And what I mean by that is it's a combination of treatments from various providers. I will say a pelvic floor physical therapist is very often, if not always, part of that treatment plan, but there are other providers that are part of that. A pain management physician can recommend different medications, whether it's medications that that could treat nerve irritation or neuralgia, or maybe muscle dysfunction. Mindfulness meditation is becoming more and more important as we're seeing through research that is being done. It's more and more effective in treating pain syndromes. And there are many ways to incorporate this into your life. And we'll talk about or I'll suggest some ways to incorporate that into your life in just a moment. And then last is interventional pain management. And these are interventions usually performed by a pain specialist that can treat either nerve or muscle dysfunction. And these might be like things like a nerve block, or maybe Botox injections, or maybe pulsed radiofrequency, things like that. So it's not that every person needs all of these interventions. It's absolutely patient specific because everyone presents a little bit differently, but these are some of the more common treatment interventions that may be appropriate for you. So the next few slides, I want to make sure that I give you something to come home with and hopefully start to use as soon as possible that can help relieve some of your symptoms if you're currently suffering. So first, I'll just start out with some research that supports physical therapy as a treatment for chronic pelvic pain syndrome. Probably many of you, if you're dealing with this already, you've realized that many medical providers are not aware of physical therapy as a treatment for pelvic pain. So sometimes it's nice to go to your physician with some research that supports this as a treatment. So the first is a study that was done some years ago, and they looked at 48 subjects with genitourinary pain, and they divided them into two groups. One group received 10 visits of myofascial physical therapy, and the other group received 10 visits of just global massage. And what they found was that those that received myofascial treatment from a physical therapist had significantly improved symptoms compared to those who just received global massage. The second study is looked at specifically men with pelvic pain, and they also got 10 visits of physical therapy, and this physical therapy included manual therapy, therapeutic exercise, biofeedback, and neuromuscular reeducation. And they also found that after the 10 visits of physical therapy, these men reported a significant decrease in pain. In fact, 50% of the participants reported a very robust treatment response, 20% had a moderate response, and 30% did not have a significant change in their symptoms. Lastly, the last research article that I'll talk about is a study that looked at just biofeedback performed by a physical therapist in men that were suffering from pelvic pain. And they looked at 31 men, and after a series of biofeedback treatments, they reported improved pain and improved symptom scores on a score sheet that they used. So all three of these studies, I'm of course going through them very quickly, but 3 studies showing that physical therapy was indeed helpful in the treatment of pelvic pain. So the next is how to find informed medical providers. And I realize this is a struggle all over the country because there's just not enough providers that are knowledgeable and experienced in treating pelvic pain. So there are a few sites that have a Find a Provider app or a Find a Provider section on their website that can help you find a provider close to you. So the first one, which I'll show you here, this is the International Pelvic Pain Society, and you can see here that you can put in where you live and what kind of specialty you're looking for. And this site can help you find physicians, physical therapists, and in some cases, mental health therapists as well. So some of the other 3 sites are to find physical therapists in particular. So I'll show you one of them, the Herman and Wallace directory. You can also put in your location and you can find a physical therapist that is close to you. So the American Physical Therapy Association section on women's health, even though it says section on women's health, you can also find providers that will also treat men. So next are some self-treatment tools that I often recommend to my patients to facilitate their recovery, so things that they can do at home. And there are other things that I use in this, but these are some of my favorite tools. The first one is the foam roller. Hopefully many of you are familiar with that. It is a cylindrical roll of foam that you can work on some of the muscle dysfunction yourself at home. The second is a thing called the stick, and the stick is almost like a rolling pin. I'll show you here, that you can also work on some of the muscles that are a little harder to get to with a foam roller, like your inner thighs. And so these tools somewhat mimic some of the manual therapy techniques that we can do. So with these tools, you can work on these things at home yourself. The next is a Theracane, and a Theracane is more to work on myofascial trigger points yourself. So you can see in these pictures that they have these little nubs on a stick where you can identify a trigger point and press the trigger point to help release it with this tool. So the last one is a pelvic wand, or also called a TheraWand. So this is a tool that can help you work on your pelvic floor muscles. So this can be used vaginally or rectally, and they have different sizes and to work both vaginally and rectally. And this is definitely a tool that you want to use with the guidance of a physical therapist. Okay? All these things are really with the guidance of a physical therapist, but particularly when you're working on your pelvic floor, you want the help of a pelvic floor physical therapist, so you're doing it correctly. Next is cushions. So we talk a lot about cushions because many of the patients that we see have difficulty sitting or pain with sitting. So there are a lot of different options out there. Again, these are some of my favorite ones. Per patient report. So the first is a tush cush. So a tush cush it has a cutout in the back. So these are often good cushions for those that have pain more towards the tailbone or anus. The cushion your assets is a great cushion that people really like. I know it's kind of hard to see here, but what it is two cushions that are on Velcro, which is in the middle, so you can pull those two cushions either together or apart, whatever fits your particular pelvis. So this is good for folks who have pain in the perineum or the genitals. You can really relieve that pressure when you're sitting. And the TheraSeat is another one that has a cutout in the middle here, so you can see. So there's a cutout, and this is all cushion, and it comes in an oval or also a round. So this is another option if you have pain with sitting. And we really recommend that you try these because different people are going to have success with different cushions. So going back to the mindful meditation apps and tools, again, there are lots of things available these days to help you meditate or teach you to meditate, because it is a practice. You're not going to be good at it day one. You really have to work at it. So there's a few different tools that can help you with that. So the Spire Stone is a wearable device that tracks your breathing. And part of a mindfulness practice is regulating your breathing. So this tool will help you do that. There are many different apps out there that have various mindfulness practices or that you can listen to, that they'll take you through. These are a couple that are quite popular with patients. One is called Calm, and the other is called Simple Habit. And they have different links of meditations for different things, for different times of the day. So I would recommend checking those out to get you started. And then if you're someone who uses, say, an Amazon Echo or an Apple Watch, they also have meditative practices available with their devices as well. So whatever it is that you use on a daily basis, likely there is some sort of app or application that can help you get into a mindfulness practice. So some other helpful resources, of course, our book, Pelvic Pain Explained, that Stephanie Prendergast and I wrote a couple of years ago, is really a patient-directed book that will help you navigate this process if you are suffering from pelvic pain, to help get you to the right people and help you through that recovery process. There's an online support group out of the UK. To. So this is a group for men with pelvic pain that may be helpful to you. I know we get a lot of questions from patients if there are such things, and this is something that you can check out online. Explain Pain is one of my favorite books that I recommend to patients. It's by Laura Mosley and David Butler. They're a group out of Australia, and they talk about the science behind chronic pain and how it changes our nervous system, how it changes our brain, and some ideas of how to treat that. So if you haven't heard of that book, I would recommend checking it out. Tame the Beast is a collection of resources about pain, about the science of pain and how to treat it. It's a really great collection of resources for patients. I would highly recommend checking that out. And the last one is our blog. We publish a post every week that we work very hard on. And, we really wanted it to be a trustworthy, data-driven, informational post each week. So if we have posts on just about everything to do with pelvic pain at this point. So if you haven't checked it out yet, I would encourage you to do so. So lastly, we asked for your questions about male pelvic pain through different social media sites, and these are some of the questions that we got, so thank you very much. The first was, how to cue male pelvic pain activation in relation to Valsalva maneuver or bracing for weightlifting? And I think that more importantly, so some of you may know when you lift something very heavy, you have the tendency to hold your breath or bear down, which is what a Valsalva maneuver is. And so I would say that I would recommend to, instead of doing that, to activate your transverse abdominis, which is your lower abdominals, to help support your spine and your pelvis more when doing any sort of weightlifting activity. So by contracting your transversus abdominis, you help support your spine, and that would actually be less strain on your pelvic floor muscles versus practicing a Valsalva maneuver, which is actually more strain on the pelvic floor. The second question is pain after ejaculation pelvic floor related? And I would say very often yes. So the muscles that are intricately involved in ejaculation are some of the superficial pelvic floor muscles. So if those muscles are dysfunctional or too tight, when during ejaculation, those muscles rapidly contract and relax. And if they're too tight, they often stay tight after ejaculation, which can produce pain after ejaculation. So that is something that can be successfully treated with a pelvic floor physical therapist. And this next question is a great question. We get it all the time. So mountain biking and prostatitis, is that actually the prostate gland or is it the pelvic floor muscles? So it's important, like I said before, to make sure you rule out any prostate pathology. But if there is no prostate pathology, then yes, I would say there's a very good chance that it is coming from your pelvic floor. And the last question was, my pain began after hernia surgery. Can PT help? And the answer to this is absolutely. So hernia surgery, it's usually an ilioinguinal hernia. And when you have that repair, it affects the surrounding muscle tissue and sometimes nerve, the ilioinguinal nerve. So manual therapy can help normalize those tissues and decrease pain or dysfunction, whatever it is that you're experiencing. So lastly, as I mentioned before, Stephanie and I wrote Pelvic Pain Explained a couple of years ago, and we are giving away books. So if you go to our website, which is pelvicpainrehab.com, at the bottom of our homepage, if you fill out this form, you can possibly win a book. And of course, we are on social media. So if you don't already follow us on Facebook or Instagram or Twitter, here's where to find us. And as I mentioned before, we have a blog that we post weekly, and that's where to find us. And I would encourage you to check it out. So again, thank you very much. And if you have any further questions, feel free to email me. Thanks a lot.